So the project is titled, Does an online oral anti-cancer medication education program targeted at community pharmacists improve their knowledge and confidence in dispensing oral anti-cancer medications? So as you would all know, oral formulations of chemotherapy have been around for decades, including cyclophosphamide, melphalan and tamoxifen. However, my research project has been designed in response to the rapid expansion in oral cancer treatments in recent years. Approximately 25 to 35% of all anti-neoplastic drugs in development in 2013 were oral formulations, specifically cytotoxic agents, small molecule inhibitors, and receptor-targeted agents. The paradigm shift from intravenous intermittent infusions in oncology units to oral dosing in the patient's home, as well as PBS requirements, has had significant implications for the provision of medications and adherence to dosing regimes. Through my work at the Illawarra Cancer Care Centre, it was identified that this paradigm shift was not accompanied by appropriate education, particularly for the community pharmacists who are now responsible for the majority of dispensing for oral anti-cancer medications. Overseas research by Abbott et al. And O'Brien et al. Demonstrates that pharmacists lack both knowledge and confidence regarding oral anti-cancer medications, and this has the potential to impair patient education and understanding. We also know that medication adherence with oral anti-cancer therapy is more difficult to assess than other available options and has potentially fatal consequences. Patient education is vital to ensure patients are aware of factors influencing medication adherence, and the pharmacist plays a really important role. Based on this research and my practice observations, I developed the aim to evaluate the impact of a tailored online oral anti-cancer medication education package on the knowledge and confidence of community pharmacists required to dispense these medications. I hypothesised that the development and implementation of such a program would improve their knowledge and confidence with regard to oral anti-cancer agents. In order to achieve this aim, I needed to identify areas of knowledge where community pharmacists perceived a need for improvement regarding oral anti-cancer medications, develop a tailored online education package for these community pharmacists, assess the knowledge of community pharmacists regarding oral anti-cancer medications, and compare these pre- and post-assessment, as well as examine the improvements in knowledge and whether they're maintained. Finally, I wanted to assess community pharmacists' confidence dispensing oral anti-cancer medications. With these research objectives in mind, I created my project's methods. A semi-structured focus group was designed aiming to assess the extent of oral anti-cancer medication dispensing in the community, the confidence pharmacists have dispensing these medications and factors which may influence their confidence, as well as whether pharmacists felt education would be useful with regard to oral anti-cancer medications. Results would then be analysed and used to tailor the online education program. The focus group consisted of 7 participants. The transcript was analysed and 2 overarching themes were identified: lack of knowledge or information and lack of confidence. Participants identified that education at the undergraduate level was lacking with regard to oral anti-cancer medications. They were unsure or unable to access treatment protocols and concerned that their lack of knowledge was impacting on patient care. They also highlighted the infrequency of dispensing these medications and the potential consequences of incorrect information as factors affecting their confidence. So this is a screenshot of the online interface for my education program. And as I mentioned, clinical questions were designed in response to focus group data, as well as reviewing programs already designed by Peter Mack and Victorian Tag. The other programs concentrated on the safe handling of oral anti-cancer medications, and in consultation with other pharmacists, it was decided that my education program would focus on indication, dosing and counselling points of PBS-listed medications. Each of the clinical scenarios, such as the one demonstrated on this slide, comprise questions pertaining to the knowledge-based pre-assessment component of the project. When answering all knowledge-based questions, both pre- and post-assessment, the participant is also asked to rate how certain they are that the answer is correct. This method of confidence assessment was developed and utilised by Charles Mitchell in certainty-based marking and is also depicted on this slide. Following each clinical question, there is a detailed explanation of the correct answer and further comments providing education and additional resources to the participant. Once all clinical scenarios are completed, the participant is required to answer post-assessment knowledge-based questions, again accompanied by a confidence question. After completing the entire education program, participants are contacted 4 weeks and 12 weeks later and again asked to complete the post-assessment survey. And this is designed to ascertain whether the impact of the education program has been retained. So to date, I have received completed education programs from 50 participants. Most participants report having 2 to 5 years pharmacy experience, and the approximate number of oral anti-cancer medications dispensed each month was reported as either 2 to 5 or 5 to 10 by the majority of participants. The most frequently dispensed medication was tamoxifen, followed by methotrexate and capecitabine. Interestingly, 88% of the participants reported not having received adequate oncology education at an undergraduate level, but only 24% attended oncology continuing education. This graph illustrates the distribution of knowledge scores pre-assessment. Participants on average answered 60.5% of knowledge questions correctly in the pre-assessment, with results ranging from 25 to 100%. In this particular project, the knowledgeable benchmark was set at 80% or more correct answers, which you might have seen in other education programs. Pre-assessment, 42 of the 50 participants did not achieve the knowledgeable benchmark. Post-assessment, 96% of the participants achieved the knowledgeable benchmark of 80% or more correct answers, with the other 2 participants achieving 60%. The mean improvement in knowledge scores was statistically significant, and the project was able to demonstrate a statistically significant association between completing the education program and the attainment of knowledge. I also conducted a subgroup analysis on the pre-assessment knowledge questions to evaluate if there were areas which could be targets for further research. This analysis demonstrated that the majority of participants correctly answered questions pertaining to counselling points. However, the knowledge of side effects, adjuvant therapies, and mechanism of action was highly variable. As I mentioned, confidence was assessed using the method described by Charles Mitchell. Participants were asked to rate their confidence for each knowledge question as either no idea, it's a guess, moderately, or very confident. As you can see in the pie charts, in the pre-assessment survey, the participants most commonly answered no idea, it's a guess. After completing the education program, in the post-assessment, this answer changed to moderately. The change in confidence answers was again statistically significant pre- and post-assessment, and there was also a statistically significant association between completion of the education program and the attainment of confidence. I also decided to review the relationship between knowledge and confidence, as I was interested to see if confidence was associated with knowledge. I was particularly concerned with the possibility of participants being very confident in incorrect answers and its potential implications for patient care. Results demonstrated that pre-assessment, participants were most frequently incorrect and reported having no idea, followed by correct and moderately confident. Importantly, in the pre-assessment survey, when participants were incorrect, they only answered very confidently 2.3% of the time. When participants answered correctly, they were moderately or very confident 63% of the time. It's also not surprising, given the improvements in both knowledge and confidence that I've already mentioned, that the most common combinations post-assessment were correct and either moderately or very confident. Another aspect of this project was to assess factors which may influence the knowledge and confidence of pharmacists with regard to oral anti-cancer medications. Factors influencing knowledge include the number of years practicing as a pharmacist. Pharmacists with 5 to 10 years experience scored highest pre-assessment with 65% correct answers, with the lowest scores achieved by participants with 2 to 5 years experience, 57% correct. However, this result was not statistically significant. What was interesting was in the post-assessment, there was a non-significant trend towards the less experienced pharmacists achieving higher knowledge scores. Unsurprisingly, the number of oral anti-cancer medications dispensed correlated with knowledge scores. And also, participants who attended oncology continuing education achieved higher knowledge scores. And results were similar when discussing confidence. The most confident participants were those with the most experience, those who dispensed the most oncology medications, and those who attended oncology CE in the previous 2 years. So this project adds a local perspective to global research, particularly that that's been conducted in Canada with respect to oncology education at the undergraduate level and through continuing education. The lack of knowledge and confidence regarding oral anti-cancer medications, which has been demonstrated overseas, has now been replicated in an Australian setting. This research has also identified a gap in the education of community pharmacists, both at an undergraduate level and in continuing education. The education program was designed to address this CE knowledge gap and was able to illustrate knowledge gains. This program also complements education programs already available to community pharmacists, including Oral Anti-Cancer Therapy by Gail Rowan, which addresses verification and checking of oral anti-cancer prescriptions. It's hoped that the positive results of this study will encourage a wider distribution of the education program through promotion of the research, as well as facilitate the development of other programs by having identified areas of oral anti-cancer medication where knowledge is lacking. Further research is still required to evaluate the impact of this improved knowledge and confidence on patient care and to investigate oncology education at the undergraduate level. Okay, that's it. Thank you.